all the votes have been tallied, health insurance reform becomes law in the United States of America.
The president promised that Obamacare would bring health insurance to more people. That would save lives and lower costs. It did bring health insurance to more people, but as you know, some people didn't get to keep their doctors, and costs are up sharply in some states. But whatever we think about Obamacare, there is one great thing about it. It got Americans to start thinking about how we pay for health care. And that got patients and doctors to try new things. And some of those things are very good because they allow the market to work its magic. The surgery center in Oklahoma posted prices and said, "We don't take insurance." That allowed them to lower prices so much they now attract people from 1,000 miles away. This couple came to the Oklahoma clinic from New Hampshire. There, they had tried to get a price quote for surgery on his arm. They found it was very expensive, or when they asked a doctor or a hospital, they couldn't even get a price.
They just looked at us with a blank stare. No one would even give us a price. One day over the phone, someone gave us a quote of around $15,000, and the price for this surgery here was a third of that.
A third of that? How could one clinic be that much cheaper? Well, let's ask Dr. Tom Joseph, who's now done something similar in Atlanta. Really, basically the same thing you're doing in Atlanta.
Oh, yeah. I mean, I used him as a model. As things got more and more confusing, you know, why does it have to be this way? And I don't really think it has to.
How can you do it so much more cheaply?
It has to do with the overhead that comes with taking insurance. So once you take insurance and the third-party payer system out of it, then the costs just plummet. My costs are like a third.
There's so much overhead of hiring people to do the paperwork, of dealing with the insurance companies.
Absolutely.
The whole premise of Obamacare, and frankly, a lot of the Republican plans, is getting people more insurance. But that means somebody else pays.
Yes.
It is a market, but it's not a real, it's a market that can't work its magic because somebody else pays.
Yes, absolutely. When you have a third-party payer system, it just doesn't work efficiently. So once you take that out of it, you take away the billing. I have no billing. There's no insurance.
What do you mean you have no billing? You come in and they
come in, they pay, and then they get. So it's a $300. That's right.
Up front,
and then
follow-up visits
included.
$80.
$80. Everything's included. So they come in, they pay $300, and then that's done. So they come in, they see me. They're examined by a board-certified orthopedic surgeon. I get x-rays. They need a cast, a splint, an injection, whatever they need. It's just all included. So they don't have to
make money on that?
Yes. I don't have to have a billing department. I don't have an insurance department. I don't have to have a coding department. I don't have electronic health records that are a total waste that do not help patient care. They just don't.
What if the patient doesn't have $300?
If they don't have $300, we have a credit company that will actually extend them credit. It's affordable and it's simple.
A third of your patients have no insurance. A third have a high deductible plan.
Yes. That's the one thing I like about the Accountable Care Act is that they have really increased the deductibles, and that makes people pay attention because they're out of pocket for $3,000, $5,000, $10,000, and once their money is on the line, all of a sudden they're paying attention. But the really difficult part,
before
like
that,
you
people
cited,
paid no attention. I'm on Medicare. Nobody even talks about price. Nobody pays attention
because you don't care if something costs $5 or $50,000 because you're not paying. Why would you care? People ask questions whenever it's their money on the line. They don't ask any questions when it's somebody else's money, and therefore the costs just keep going through the roof.
But the one area of specialty where people pay their own bills in medicine, like LASIK eye surgery and plastic surgery, prices come down.
Absolutely.
And the
quality goes up.
Quality goes up. The waiting rooms are nice, and I bet you have to work at being nice to your customers.
I don't know why it isn't just immediately apparent to people. I mean, it's just so obvious to me, and obviously you. But it's just, I mean, why would you want someone else to take? People need to take control of themselves, and as a result, things improve.
But people say it's too expensive. Medicines, we can't afford to pay it ourselves.
It doesn't have to be that way. If anything that I truly believe is it doesn't have to be this way. It doesn't have to be so expensive. If people were involved in it, it would come down just dramatically.
Just from market competition.
Just from market competition and people paying attention.
Things that cost $5,000 would cost $500.
Easily. Yes. I mean, you start looking around at MRIs. MRIs at the hospital are like $3,000, but there's one that I know of that's $280. But no one asks questions if you have insurance, so they just pay the $3,000.
Thank you, Dr. Tom Joseph.
Thank you.
Good luck for what you're doing.